Today we are discussing how intravenous vitamin C is being used to treat cancer. My name is Johanna and I'm so excited to have you with me. But before we get into that, I'd like to briefly mention how COVID-19 is being successfully treated with intravenous vitamin C. If you're interested in checking that out, please visit orthomolecular.org. Now, let's get into the interviews with physicians on how they're using intravenous vitamin C to treat cancer.
Lead researcher Murata did one of the first trials using high-dose intravenous vitamin C. Clinical trials administering high-dose vitamin C, also called ascorbate, to terminal cancer patients were conducted in 2 hospitals in Japan in the 1970s. They treated 99 patients at the Fukuoka Torikai Hospital. They measured the survival time from the date they were declared to be terminal. Those receiving only low-dose vitamin C lived an average of 43 days, but those receiving high-dose intravenous vitamin C lived an average of 246 days. An increase in survival from 43 to 246 days is a dramatic extension of life. The trial was repeated in Kamioka Kozan Hospital in Japan. The 19 terminal cancer patients not receiving high-dose vitamin C lived an average of only 48 days, while the 6 high-dose vitamin C patients lived an average of 115 days. At the end of the study, one of the 6 was still alive at 215 days. They also noted the quality of life was improved significantly. In 2009, a review of the trials of high-dose vitamin C, also called ascorbate, was done by lead researcher Ono. He notes 2 more studies showing increased survival in terminal cancer patients receiving high-dose intravenous vitamin C. In 1978, Cameron and Pauling published the response to high-dose intravenous vitamin C in 100 terminal cancer patients in whom conventional therapy was no longer considered useful. In general, they were given 10 grams of intravenous ascorbate daily for 10 days, followed by 10 grams orally indefinitely. Their survival time was measured from the date of being declared terminal to the date of death. This survival time was compared with 1,000 similar retrospective terminal cancer patients who did not receive high-dose ascorbate or any other definitive treatment. The patients receiving intravenous lived an average of 300 days longer than those not receiving the high-dose intravenous vitamin C.
Another physician that I had the privilege of speaking with is Dr. Moffitt, who works at the Reardon Clinic in Hays, Kansas. He is a naturopathic physician who is an expert in intravenous vitamin C treatment.
So a lot of patients can benefit from the use of high-dose IV vitamin C. Whether or not they're going to do well with it as a sole therapy is another scenario. Often I do run into situations where we've got to switch up protocols, or as I don't know if you're familiar with the Reardon Real Health panel. So we actually will look at a lot of different vitamins and nutrients as well, or amino acids, hormone production, thyroid production, and overall inflammatory load, and kind of get a better metric to see what is a specific treatment for that patient. A lot of our scientific basis does come from our RecNec project, which is a research collaborative that our Wichita location usually puts on through a variety of sponsorships and everything else, to where we gather research data with our researcher. She helps to collaborate a lot of the data together to where we actually will track inflammatory markers or cancer markers or inflammation overload, or whether, depending on what study she's looking at. So we will use that to fuel a lot of our own research, and we're always trying to reevaluate how we're treating cancer specifically. Even though we don't necessarily treat cancer, we just happen to treat the patients that have cancer. But the data does show that one of our biggest studies was with prostate cancer, and just the observance of PSA lowering over time is one of our biggest metrics. But we'll also look at whether or not there's inflammation overload, and kind of ways to go about that. Some other ways that we get our research is through PubMed. So obviously PubMed is a research database that different researchers from all over the world will post to. IV vitamin C is pretty big across the nation, so even in Europe, or they'll collaborate a lot with the vitamin C treatments as well. We even have quite a few docs that we've treated and trained all over the world that do training with us specifically to use our protocols, which our protocols are open platforms. So we post those clearly on our websites for other docs to kind of follow if they know what they're doing when they divulge into that. And we use a specific concentration that we shoot for when we do our high dose vitamin C. So we're looking for serum values of about 400 milligrams per deciliter is what our research has shown us best to be cancer killing or promoting apoptosis or tumor cell size reduction. That's going to be on a practitioner to practitioner basis per level. That being said, I've not seen a single patient that does not benefit from my high dose vitamin C one way, shape, or form. So the biggest turnaround that we will see is lack of symptoms that they'll feel, and fatigue and improvement in sleeping are probably some of the biggest factors. So vitamin C does not have any specific action per se. It's responsible for many, but to pertain to your topic of cancer, vitamin C is very much a pro-oxidant and antioxidant. So we actually, with cancer cells, it's shown that there's a lack of apoptosis, which is programmed cell death. So with the vitamin C, it actually helps to increase the peroxidase production in cancer-causing cells. But in normal, healthy cells, we actually have a regulatory mechanism that kind of keeps that under control, so that's not over-oxidative, which you'll see some of that debate out there. But we don't find that. So on that question, kind of going back to how I've answered before, the catalase enzyme is something that is present in a healthy cell where it's not present in an unhealthy cell, so a cancer cell. So with the catalase enzyme, it breaks down that hydrogen peroxide, which can be oxidative, but oxidative stress is a good thing as long as we get controlled mechanism at the end. And so with that breakdown of the catalase enzyme from hydrogen peroxide, it breaks it down into simple water, or even a hydrogen molecule or oxygen molecule, where with that cancer cell, like I said, that catalase enzyme is missing. So you just get that continued oxidative stress in that unhealthy cell, which is what you want to die. So generally speaking, when somebody comes in for an IV, we'll get the nutrients mixed up per our protocol, and then you will go see one of our nurses, and they will kindly get your IV started. So it's just a quick little poke right here in the arm, typically. If we can use PICC lines too, if somebody has one installed. And then depending on the gram dosage, you're looking at a treatment of anywhere from 30 minutes to 2 hours on average. Yet again, depending on the gram dosage of that IV vitamin C that you're getting in there. It's infused at a rate that is generally comfortable to the patient, and if it starts to kind of burn or tingle a little bit, we can slow down the drip, and then we can also add in more sodium bicarb to kind of balance the acidity to make it more comfortable.
Do you believe that IV vitamin C is or is not helpful in the treatment of cancer, and what is the scientific basis for this view regarding the use of, IV vitamin C?
Well, there was never any evidence that it was useful. And there was a major study that responded to Linus Pauling's claim that vitamin C was effective against colon cancer. It was carried out by several centers, including the Mayo Clinic, and they found no benefit. No surprise, but they did it.
I looked up the Mayo Clinic study that Dr. Barrett just referred to and the comments that he makes about it on his Quack Watch website. The website shows that the Mayo Clinic conducted its study on intravenous vitamin C in order to evaluate a prior study by Pauling and Cameron, which claimed a longer patient survival time in those using high doses of IV vitamin C. Most researchers are reluctant to accept this study on the basis of potential bias from the time of diagnosis to the time when the patients were pronounced untreatable and therefore treated with intravenous vitamin C. Dr. Emerson talks about Cameron and Pauling's study regarding IV vitamin C. He believes that the time periods were measured correctly.
In 1978, Cameron and Pauling published the response to high-dose intravenous vitamin C in 100 terminal cancer patients in whom conventional therapy was no longer considered useful. In general, they were given 10 grams of intravenous ascorbate daily for 10 days, followed by 10 grams orally indefinitely. Their survival time was measured from the date of being declared terminal to the date of death. This survival time was compared with 1,000 similar retrospective terminal cancer patients who did not receive high-dose ascorbate or any other definitive treatment. The patients receiving intravenous vitamin C lived an average of 300 days longer than those not receiving the high-dose intravenous vitamin C.
Going back to the Mayo study, which Dr. Barrett originally mentioned, it can be seen that even though it showed no overall benefit in survival time, intravenous vitamin C did in fact reduce symptoms and improve quality of life.
I think IV vitamin C can be helpful in the treatment of cancer. I think there is a lot of intriguing evidence out there that suggests that it could be a very powerful treatment. But we still need to, use it cautiously because we are still waiting for some really strong evidence to suggest how, what's the efficacy of this treatment and how, in which cases it applies to. We don't have a lot of clinical trial data yet on IV vitamin C in cancer. Particularly, randomized control trials that are double-blind and looking maybe specifically at IV vitamin C treatment and specific dosages that are therapeutic level. So for the most part, I think they're intriguing and they definitely are, are very plausible. For the most part, IV vitamin C is thought to induce a toxic effect, sort of similar to chemotherapy because you're inducing reactive oxygen species and that in turn induces the cells to die. But at the same time, there's still some questions. It's still speculative, and I think there's still a lot of questions. People are like, well, this doesn't really explain, like I was saying earlier, it doesn't explain why it's killing off cancer cells specifically, not really the normal cells as much.
For the majority of interviewees, while intravenous vitamin C is not a sole treatment for cancer, nor does it claim to cure cancer, it does appear to not only have the potential to be helpful, but is being helpful in the treatment of cancer. At the present time, more research is needed to bring intravenous vitamin C and its use in cancer care to the forefront, showing that it not only decreases the side effects of chemotherapy, but improves quality of life and selectively kills cancer cells within the human body.